Hello everyone, and welcome to our channel. Today, we're diving into a topic that affects many women but is often kept under wraps: female urinary incontinence. If you or someone you know is managing this condition, remember, you are not alone. We're here to share empowering and actionable strategies that can help you regain control and live more confidently. Let's start with a clear understanding of what urinary incontinence is. It's a condition characterized by the accidental leakage of urine. For various reasons, the urinary control system might not work as well as it should, leading to occasional or frequent leakage. There are several types of urinary incontinence that commonly affect women. Stress incontinence occurs during activities that put pressure on the bladder, such as coughing, sneezing, or exercising. Urge incontinence is characterized by a sudden, intense urge to urinate, accompanied by an involuntary loss of urine. Other types might combine these symptoms, but understanding your type is the first step towards managing it effectively. The causes of urinary incontinence can be varied and multifaceted. Childbirth is a common factor, as the process can weaken pelvic floor muscles. Hormonal changes, especially around menopause, can also play a significant role. Additionally, certain lifestyle factors and habits can exacerbate symptoms. By identifying the specific causes of your incontinence, you'll be better equipped to tackle it straight on with the right solutions tailored just for you. Now that we have an understanding, let's discuss some lifestyle modifications that can help. Simple changes can make a real difference. Monitor your fluid intake. Sometimes less is more, but it's crucial not to cut back too much. Aim for a balance where you're not dehydrated, but not overwhelming your bladder, especially in the evening. Make sure to use the bathroom regularly, even before you feel the urge. This can help condition your bladder and avoid sudden needs that might lead to leakage. Our diets can influence urinary incontinence significantly. Be mindful of caffeine and alcohol, as they can irritate the bladder and increase urges. Consider moderating these, especially if you notice a correlation with your symptoms. It's equally important to stay hydrated. Although it sounds counterintuitive, not drinking enough water can concentrate your urine and irritate the bladder more. The key is moderation. Spread your fluid intake throughout the day. Exercise plays an important role in managing urinary incontinence. Regular physical activity strengthens the body and improves overall health. But for incontinence, pelvic floor exercises, known as Kegels, are particularly beneficial. These exercises target the muscles supporting your bladder and can help significantly reduce symptoms. Let's go through a simple exercise that you can integrate into your daily routine: Kegels. First, identify your pelvic floor muscles by trying to stop urination midstream. Once you've identified them, empty your bladder and find a comfortable position. Now tighten your pelvic floor muscles and hold for about 5 seconds, then relax for 5 seconds. Aim to do this 10 times per session and gradually increase the duration and number of repetitions. Integrate these exercises into your daily routine, whether while brushing your teeth or sitting at your desk. Bladder training is another effective method for managing incontinence. The goal is to gradually increase the time between bathroom visits, helping to rebuild normal bladder function. Start by keeping track of your bathroom habits with a journal. Try to slowly extend the time between trips to the bathroom by 5 or 10 minutes each time. This gradual increase will help your bladder hold urine longer without leaking. Sometimes, lifestyle measures and exercises aren't enough, and that's okay. It's important to recognize when it's time to consult a healthcare professional. Persistent symptoms that interfere with daily life or emotional well-being should not be ignored. Doctors can provide additional options, ranging from medications to specific procedures for those who need extra support. Besides exercises and lifestyle changes, several products can aid those managing urinary incontinence. From absorbent pads to wearable devices, these aids can provide reassurance during daily activities. Additionally, various apps and tracking systems can help you monitor symptoms, providing valuable data to share with healthcare providers. Dealing with urinary incontinence often impacts emotional and mental well-being. Stress and embarrassment can weigh heavily, but know that you are not defined by this condition. Take a moment to practice self-compassion and understand that it's a process. Connecting with others who experience similar challenges can also provide a support network and help alleviate feelings of isolation. I want to reassure you that managing urinary incontinence is a journey. Improvement is possible, and every positive step you take is one towards regaining control. Be patient with yourself and celebrate small victories along the way. Let's recap what we've covered today. Understanding urinary incontinence and its causes, making lifestyle modifications, exploring dietary adjustments, employing the power of exercise, particularly Kegels, and using bladder training techniques. We discussed when to seek professional help and mentioned supportive aids available. Most importantly, remember the emotional aspect of this journey and be kind to yourself throughout. If you liked this video, please give it a thumbs up and don't forget to subscribe to our channel for more health and fitness content. More videos can be found now by clicking the boxes that have appeared on screen. Please leave any comments you may have and topics you would like us to cover in our up-and-coming videos. Thank you for watching. Until next time, goodbye.